Thank you, Mr. Speaker. Colleagues, I rise today to address the body and stress the importance of mental health awareness in our state. Please join me in designating May as Mental Health Awareness Month in the state of Michigan. Mental Health for America and its affiliates has recognized May as National Mental Health Awareness Month since 1949. With passage of H.R. 76, we seek to end stigma surrounding mental health and encourage us to continue conversation about how we may best support individuals living with mental illness. As we develop policy as a legislative body, it is of utmost importance to invest in treatment and provide comprehensive health care services to residents of our state. Each year, tens of thousands of our Michigan citizens are afflicted by diagnosable mental, behavioral, and emotional disorders, including anxiety disorders, schizophrenia, eating disorders, depression, and addictive behaviors.
Members, if I may have your attention, we have a colleague wishing to address us on the question before the House. The chair recognizes Representative Green.
Official reporting states mental illness impacts around 336,000 adults here in the state of Michigan in any given year. Although we know far too many people are unable to seek treatment due to financial strain or social pressures, and their cases thus go unreported or unresolved. Within the discussion, we must also recognize alcohol abuse and illicit drug dependence as a mental illness, an illness harming Michigan communities and citizens. Addiction, like any form of mental illness, requires assistance and understanding. 526,000 adults will experience alcohol abuse, and nearly 205,000 individuals ages 12 and older will experience an illicit drug dependence. Yet 91% of adults with heavy alcohol abuse and 81% of individuals with an illicit drug dependence do not seek treatment for their addiction. Mental illness is just that, an illness, and it affects anyone no matter your age. In Michigan, 84,000 adolescents will experience a major depressive episode this year. Of that 84,000, 56% will receive no treatment for their illness. In our communities, in my district, and all of Macomb County, has been hit hard by a number of extensive cuts to mental health funding over the past 2 years. In 2015 and 2016, Macomb County saw funding cuts to Macomb County Community Mental Health totaling $16,771,000, with an additional $12 million cut just a few weeks ago on April 1st of 2017. The rigid timeline for rebasing of state dollars away from Macomb County has created hardships for a number of families who rely on Macomb County Community Mental Health Services, and has left thousands without services upon which they rely. The continuation of funding cuts to Macomb County Community Mental Health and other departments like it across the state will have devastating effects to the medically fragile individuals and families supported by state funding. Ignoring mental health illnesses of those citizens who are suffering a mental, behavioral, or emotional disorder only increases the stigma, leaving them isolated and diminishing our sense of community. The people of Michigan who are living with a mental health illness or addiction require support and professional care in order to improve their quality of life, and I hope we as a body can recognize that. Mental Health Awareness Month is an important first step to show our state supports those who are living and battling with mental health disorders. I hope the proclamation will remind us we need to continue moving forward towards supporting mental health funding and combating the stigmatization of mental illnesses as a whole. I thank you, Mr. Speaker, for allowing me to address my resolution. I ask my colleagues to join me in the effort to make May Mental Health Awareness Month. Together we can be advocates for change.
Thank you, Representative. The question before the House is on the adoption of House Resolution 76. All those in favor of the resolution will say aye. Those opposed will say nay. The resolution is adopted.